Hello everybody, welcome back to my channel. If you are new to my channel, my name is Josh and I'm a biomedical science, behavioral neuroscience double major in my undergraduate studies. Today we're going to be reacting to some Dr. Pimple Popper removing an open wounded lipoma. If you have not seen my other reaction videos, click the link up in the corner while I will link my most recent. Otherwise, you can check out my playlist, which has all of my reaction videos. Not only Dr. Pimple Popper, but also some days in the life, week in the life, stuff like that. Definitely check that out. Without further ado, let's get right into it.
Hi, how are you? I'm Sandra, Dr. Lee. Nice to meet you guys. I'm gonna have a seat here. Is that okay?
Yeah.
Is there a reason why you're wearing a mask?
Yes, there is a reason. I have a few demons.
Okay.
And one of
Category is things you rarely hear in a post-COVID-19 world. Kind of funny, why are you wearing a mask? This video was posted slightly before our lockdown happened. October of 2020, I believe ours happened. Late November, early December was when our lockdown began, at least where I live. So that was kind of weird. Maybe it's from the future, you could tell it. No, but it's probably just to protect himself from infection because he's in a hospital setting.
one of them's being around sick people.
Yes, we have people here maybe that can be sick, but usually they don't have the flu or like something that's contagious per se. Okay. What are you here for?
Something that I learned in my phlebotomy training class is that 5% of all infections are nosocomial, meaning they are contracted in a healthcare setting. So if I go in healthy just to get checked up or whatever it may be, I could come out with an infection from somebody else who's in the hospital and is sick and is contagious. And the numbers on that are like 800,000. So 5% of all of the cases are 800,000 cases, and 10% of those are 80,000 will be fatal. So that's something that I learned in my class. Definitely why you would wear a mask maybe beforehand, and definitely now during COVID when you pretty much have to anyways. So that makes sense.
For my chip on my shoulder.
So how long have you had this chip, Mr. Chip?
Going on 11 years.
11 years, okay. Does it cause you pain or anything?
Constant pain.
Have you seen anybody for it?
Yes.
All right. What happened there?
They were quacks.
Okay, why?
He'll squeeze it and tell me come back in 2 weeks.
Really? He just looks at it?
Yeah.
And doesn't do anything about it?
And I went back and then he was coughing over the instruments. And,
Okay.
And I had to leave. Yeah,
So you
he
didn't
was-
really feel very safe with him,
Oh,
in other words?
Well, he scraped it, and it
Banged it up
Yeah,
hard.
and it busted it open, and now it's like an open wound.
Okay, got it. We'll take a look and see if that's okay with you. I'll make sure I put gloves on and a mask.
Okay.
I definitely see patients who have fear of doctors. Leonard is the worst I've ever seen. I pride myself on
Latrophobia, an intense fear of doctors, is a pretty common thing. It's nice that Dr. Lee says she'll try and make him feel safe and comfortable in that environment, wear a mask, wear gloves, whatever it may be, to make the patient feel most comfortable in that setting so she can actually take care of him, because this is something that may potentially affect his health, his well-being, his day-to-day life. So he definitely needs to see a doctor who's able to do more than just look at it or scrape it up and make him feel comfortable in that setting.
being really good at calming my patient's nerves, but I'll tell you, Leonard is another level. I really have to watch every single thing I say because I think any wrong movement that I make, he could be out the door. Okay, you want to show me what you got here? Oh, it is a big chip. If I hurt you at all, you let me know, okay? That hurts?
It's, I know you're doing it, that's for sure.
Just to see if it's attached to you. I've never seen anything like this. It's crazy looking. Why does it have this rolled border and this redness in the center? Like, is this?
Yeah, in the center it definitely looks infected. I'm not the doctor, I can't diagnose, I can't say that, but definitely doesn't look normal. I mean, any size, or I guess wounded lipoma, they say it's a lipoma in the title, that definitely looks different than what you've normally seen on the show if you've ever watched it or experienced this kind of treatment or removal of a lipoma or something like that. So I would guess it's infected. She'll probably still be able to remove it, but I don't know if she'll do anything different than normal. Let's find out.
Suppose this is really concerning to me, and it really makes me think that this could be something much more dangerous. Well, I don't know what chip is. Lipoma, maybe, but why is it mad and open and wouldn't it heal? The fact that it's like moving independent to you makes me think that this could be a type of skin cancer. In many ways.
So that might be one of the clues as well. It's hard to identify when I don't have the training what's skin cancer and what isn't, of course, but with how much experience she has, she's probably got a good eye for, you know, these types of mutations, or I guess what it looks like differently than a normal skin cell.
It's helpful to know what it is beforehand because that can sometimes factor into your decision making on how to remove it.
I lost 2 people from cancer. I've had these fears as long as I've had Chip. I don't want to die.
So taking a biopsy and knowing a diagnosis before you proceed with removing it is actually kind of important. But is that okay with you? That'll help us to figure this out, okay?
All right.
This is a really complex case. Leonard came all the way out here to see me, and I know he would love me to take care of this right here and right now. But the most important thing is Leonard's well-being. He has something that looks really suspicious to me. I'm really concerned about it, and I need to check this tissue before we proceed further.
So what she's doing there with that little kind of twist and cut in the skin is a skin biopsy, which is what they do to take a little sample of the cell before they remove it so they exactly know what it is, put it under a microscope, send it off to the lab. They can test it for cancer and other stuff like that based on the looks of the cells. The exact definition is a skin biopsy is a procedure that removes a small sample of skin for testing. The skin sample is looked at under a microscope to check for cancer, infections, disorders such as psoriasis. So that's what she's doing, sending it off to the lab, checking it for skin cancer before she makes a diagnosis and removal.
Any for your thoughts? We can't undo it now. It's all right. I know, I heard too. They got masks on back there, Lenny. Lenny. Okay, we made it through the plane ride and everybody was coughing. Okay?
Just a plague.
No, you got your mask on and they got theirs on. I am feeling very worried about whether Lenny is going to do this or not. Hi.
So obviously it's a very real fear to think that somebody's infected or they're going to give you an infection, even if you have a mask on, if they're coughing around into the open air. And you have those particles kind of floating around, they have a hang time. And that just means that they're in the air a certain amount of time before they kind of drop or fall or whatever that may be. Very real fear. Glad they got him back into the office. It says in an attempt to keep him calm, Sharon blew up a latex glove and made him a chicken. It's kind of just like you do what you can to keep the patient not really safe, but just like in a comfortable mood or setting to make sure that you're able to do what you need to do as a doctor to keep him safe and protect him from, you know, whatever the thing is on his arm. You do what you do to make sure the environment's right so he comes back and sits down and everything is all right.
How are you?
I am.
Nice to see you. It's glad you made it back here. Leonard is back. He has this really crazy looking extra appendage on his arm. And I was really concerned when I saw it first. I thought, you know, this could be something bad. This might be something that needs a more elaborate surgery. So I did send it out for pathology and I have the results back today. That tissue that I took from you came back with mature adipose cells, consistent with a lipoma. No atypical features and no evidence of malignancy.
Adipose cells are just fat cells. That's what a lipoma is. That's really good, definitely a good sign that she'll probably be able to remove it right now if he chooses to do so and if she, you know, offers it and keeps him calm and stuff like that. Definitely good to have adipose rather than, you know, melanoma or carcinoma, which are the types of skin cancers that she mentioned earlier.
Let me put some numbing there on the surface of the skin. You okay?
Yeah.
You sure?
No.
Sorry, dear, sorry.
It don't feel like it.
It doesn't. You know that I'm sorry. You think that I'm trying to hurt you?
That's what it feels like.
All right, let me let her do some nice cleaning of this area, and I'm gonna go get myself fully gowned up, okay?
I might still be here. Once she starts, I'll be all right. Unless I hear a chainsaw start up.
It's looking pretty good right now.
That's what I say every time I look in the mirror.
With Leonard, I use the tumescent technique of numbing, which really plumps up this area and makes it very visible.
So what she said there, she was using the tumescent type of anesthesia. Looking that up, you can see tumescent anesthesia is a technique commonly used in cosmetic and dermatologic procedures, exactly what she's doing. It involves subcutaneous infiltration, just meaning under the skin. Infiltration of large volumes of tumescent fluid, which contains lidocaine, which is a numbing agent, saline, and epinephrine, which are the, you know, factors, I guess, the parts of it. So it's 0.05% or 0.1%, and then epinephrine, which is 1 to 1,000,000 ratio to produce anesthesia, swelling, and firmness of targeted areas. That's because you want it to swell up So there's no, I guess, potential stretch of the skin. There's no, looseness in the skin when you're cutting it open. You want that to be tight so that you know exactly what you're cutting, and there's not like any, I guess, jagged edges. So you've got a straight, smooth cut when it's pluffed up, kind of swollen. But yeah, she's using tumescent anesthesia.
And very puffy. What I'm gonna try here is, instead of using a linear incision, I'm gonna do a circular incision so I can remove that damaged skin there. And once I pull whatever's inside there out, I can really use this normal skin to create a nice little closure. I'm gonna use my finger to move around here, and that's because that's very safe. It's blunt, the section. Look, here's your lipoma coming out. You know, Chip's pretty cute.
Of course, she gets that from me.
Definitely smart to use your finger kind of to probe around and palpate or feel, as they say, the area, because it's smoother. It's not as jagged as a knife or as sharp as those scissors that they use. Probably makes them feel more comfortable, because with this patient, she was talking about how she wanted to make him feel comfortable, and she thinks anything she could do that might scare him off, he would run up and leave during the procedure, which is definitely dangerous. So it's very smart on her end.
Your lipoma is gone now.
Oh my God.
See how it's like these globules? These multiple lobules that were tucked in there? You saw it come out, it was like a flower.
Honestly, I am in shock right now. When I seen what come out of Leonard, I ain't got a weak stomach or nothing, but that's just not for me. Seriously, I was sitting there thinking to myself, okay, the bathroom's right around the corner, I know where it's at.
You did really good. Now let's fix you up though, make you...
I don't have a weak stomach either, and it's kind of funny because the people that I live with, my roommates in college, all do. And they one time walked in on me watching Dr. Pimple Popper removing lipomas and cysts while I was eating breakfast. So I had a bowl of cereal and I was watching her remove cysts, and they didn't understand, but it doesn't matter.
Look pretty, okay? Leonard's lipoma slipped out so nice and easily. It really was the best case scenario for him. Thank goodness. I think I really broke him down a little, but I think I relaxed him a little.
From initial incision to tray took less than 5 minutes. That is a pretty quick procedure, which probably means she has a pretty great case volume for the amount of patients that she sees per day. If this one was 5 minutes long, the average might be 5 or 10. That's pretty crazy. So that is the end of the video. Pretty awesome to see. I'm glad that she was able to make him feel comfortable, so he was able to sit in that doctor's office, because obviously fear of doctors is a very real thing. Fear of catching a virus, a nosocomial infection in the healthcare setting. It's definitely a real thing. It happens. Wearing that mask, wearing those gloves, wearing PPE, personal protective equipment, definitely helps, makes the setting right for him, just so he feels comfortable, because it's always about the patient, making sure that they're comfortable in any situation, and especially when removing something that's potentially skin cancer. So that was really awesome to see. If you guys did enjoy, drop a like on the video and a subscription to the channel so you don't miss out on any future videos I have coming, and I will see you all in the next one. Peace.